In these uncertain times, we're committed to sharing information to help. And tonight, state health officials made changes to California's vaccine distribution plan to make it easier to understand. But reporter Adam Rakusin explains some believe the changes are causing even more confusion.
Another week and another set of changes to state policy dealing with COVID-19. This time, the changes impacting vaccine distribution.
Californians were understandably confused by mixed messages, variability of eligibility across the state, when it's my turn, who's going next.
So, to simplify things, the state is moving to an age-based system. That's after they get through the current tier, those 65 and older, healthcare and essential workers, among others.
Chest pain, rashes, you need to let us know or honk your horn.
As of Wednesday, the state's received close to 5 million doses of the vaccine. Healthcare providers have reported administering around 2.7 million doses.
Very, very happy to know that maybe my future is going to be a very healthy one.
While some are moving closer to staying healthy, the state acknowledges
there, of course, is going to be some sectors of our population that don't come to the front of the line as quickly as some others. And we're working through to make sure that that communication is simple, well understood, because the worst thing is when people don't know where they are in the line and trying to communicate that as clearly as possible.
Disability rights advocates say that new approach is a problem for some in high-risk categories.
That it feels like we're not a priority and that the state is basically saying to us, we know that there are equity issues if we leave out people with disabilities, and we want to solve those issues, but we're not sure how we're going to solve it. And in the meantime, we're going to vaccinate a bunch of other people.
Andy Imparato is the executive director of Disability Rights California.
We're very concerned that people who are at very high risk of dying from COVID might not have access to a vaccine until May or June, based on what we heard from the California Department of Public Health.
So, what do county public health officials think of the state's move on the vaccine plan? They're still digesting the changes.
I think that is evolving, so I don't have a really quality answer for that question at this time. We certainly will be back with you as we begin to get more information.
Dr. Penny Bornstein's the San Luis Obispo County Public Health Officer. While each county moves at its own pace, as a gauge, we asked her when she thinks that county will be past 1B and to the rest of the public.
Predictions of vaccine supply and the uptake in different sectors is something that is very challenging to predict. In very general terms, I think we're still looking at summer at the earliest to get to the general population.
Adam Rakusin, KSBY News.
This week, the state also rolled out a website called My Turn, so it will eventually allow people across California to sign up and receive alerts on when they're eligible and then reschedule their appointment. And to learn more about that website and resources on health, head to our website, ksby.com, and click on the Rebound.